Hi, my name is Clint Wadsworth. I work with GBS Benefits, and today we're going to be talking about healthcare reform basics. There seems to be a lot of questions in the marketplace about individual health plans, Obamacare, tax credits, penalties, and so we're going to try to simplify that by just giving you a few basics. When we talk about healthcare reform, we like to tell it in the form of a good news, bad news story. So let's start with the good news. With the new healthcare reform laws that have been implemented over the past couple of years, now everyone qualifies for a plan regardless of health issues. So if you had any pre-existing conditions, cancer, any other kind of disease in the past, you probably couldn't qualify for an individual health plan. That has now gone away, and now everyone qualifies for a plan. All the plans that are offered on the market today have to have what is called essential health benefits built into them. For example, preventative care is an essential health benefit and it needs to be covered 100%. Maternity is also an essential health benefit. It's covered 100%. There's several essential health benefits, but the basics are those: preventative care, maternity, emergency room visits, doctor's office visits, prescriptions, just to name a few. Now, because folks no longer need to fill out health statements to qualify for an individual health plan, because that's gone away, in exchange, it's been replaced with an open enrollment period. So basically, you have to enroll in an individual health plan between November 15th and February 15th of every year, unless you have a special enrollment period. An example of a special enrollment period would be like a marriage, divorce, birth of a child, or death in the family. If you don't have a special enrollment period, then you need to enroll during the open enrollment window between November 15th and February 15th. So here's the bad news. If you don't have a qualified plan in place by the time the enrollment period is over, and at the end of the year when you go to file your taxes, you could have to pay a tax penalty. Some really low income families may not have to pay a tax penalty, but for the majority of Americans, for example, in the year 2015, the tax penalty would be 2%. So if someone was making $100,000 and they did not elect to get a health plan, they could pay as much as $2,000 in the form of a tax penalty. In the year 2016, it's going to go up to 2.5%. Here's the good news, though. The federal government knew when they rolled this out that not every family in America would be able to afford a health plan, nor would they be able to afford a tax penalty. So they are offering assistance in two different areas. The first one is what is called a premium subsidy or a premium tax credit. And how this works is in the event your income is low enough, and I'll show you some examples here in just a minute, you can actually qualify for assistance to help you pay for those premiums. The other area where they help you is in the form of a cost share subsidy. And what they do with the cost share subsidy is they'll take a higher deductible plan, and if you qualify, they'll reduce that deductible and the out-of-pocket maximum on that plan. Here's an example. As you can see by this chart, what you do is you go over to the left and you find how many family members are in your family. So for example, if you had 4 people in your family, if you made between $23,000, or I should say $23,550 and $94,200, then your family would qualify for a tax credit. That same family, if they actually made between $23,550 and $58,875, then they'd also qualify for a cost share subsidy. And that would mean that their deductible would be reduced, or their out-of-pocket maximum would most likely be reduced. Now, our firm represents every major health carrier in the state. There are a few health plans that do not participate on the federal exchange, and that's important to know because the only way to get the tax credits is you have to apply for a plan through the federal exchange. and we'll help you do that. So let's just show a few examples. So John, who's 49, his wife Sandra is 43. They have 2 kids, Brianna, who's 11, and Michael, who's 8 years old. As a household, their family earns $60,000 a year. That would qualify them for a premium tax credit of $398 per month that they could use towards the purchase of an individual health plan. In this particular example, they chose to go with Arches. They chose Arches Preferred Care Clinic Smart Saver plan, which is a silver level plan. That particular plan has a $3,000 deductible that would be applied for all major surgeries and so forth. Their out-of-pocket maximum is $6,000. What's nice about this plan is if they go to the doctor's office, they only pay a $5 copay, or if they need to pick up any generic drugs, they'd only pay a $5 copay. But if they had anything major, for example, they had to go through a year's worth of chemotherapy and it was going to cost $300,000 or $400,000, the most they would pay under this plan would be $6,000, and then Arches would pay the remaining balance. Now, this plan typically costs almost $850, but after we apply the tax credit, John and Sandra only pay $451 a month to insure their family. Now, let's suppose that John and Sandra earned only $35,000 a year. Well, as you can see by this example, their tax credit would go up to $693, but they would also qualify for a cost share reduction. So once again, if we go back to the prior example, you can see that in the prior example, they qualified for a plan or decided to choose a plan that had a $3,000 deductible. Because they qualify for the cost share reduction, that same $3,000 deductible plan has been reduced to a $0 deductible. And the out-of-pocket max that was $6,000 before now has been reduced to a $500 out-of-pocket max. So essentially, Sandra, for example, could have a baby and it would only cost her $500 for herself, or $1,000 for the entire family. And then Arches would pick up 100% of the remaining balance. Now, I will just point out that that out-of-pocket max does include any costs that they'd pay out of their pocket towards office visits or prescriptions. Once the individual or the family hits their out-of-pocket max, they literally do not pay out another penny. Now, after that $693 a month tax credit, you can see that John and Sandra would only pay $157 a month for this particular plan. So that about sums it up. Just a couple of things to remember. You have to enroll in an individual plan between November 15th and February 15th. If you'd like to see what your tax credit would be, or if you'd like to receive a free health insurance quote, you can call us at 435-879-7889, or you can email Katie in my office at katie.stack@gbsbenefits.com. Thanks for watching.